COVID-19 projections by the Institute for Health Metrics and Evaluation. The worst is yet to come. The Global Health Research Center has been projecting peak dates and total deaths per state in an effort to adequately prepare. Big 2's Felice Romero has been looking into our state's peak day and what it means. Felice.
According to these projections, we're 12 days out from peaking in terms of resources and 13 days out from peaking in terms of daily deaths. But what does this all mean? I spoke to a Texas surgeon who says it's going to get worse before it gets better. It's been weeks since people were asked to self-isolate and practice social distancing. According to research from IHME, this is far from over.
We have to begin looking beyond ourselves and be thinking about other people and, trying to minimize the spread of this disease for the short term. We're not going to decrease the number of people who get the virus.
With the way things are going right now, IHME projects that Texas will see the most deaths in one day on April 20th. And in terms of resources, will peak on April 19th.
I've been in the ICU and I've seen these people. They're alone. I mean, we can't even let people in the hospital because of fear of transmitting the disease to other people. The whole idea of flattening the curve is just prolonging that time period so that the incidence slows down so that we have the resources to deal with all the sick people we're going to be faced with.
Although there are some younger people testing positive for the virus, most of the concern lies in the older population, and flattening the curve is one way to keep them safe.
People who have other medical problems who are going to get sick, the older people with a lot of medical problems, or people who are, immunosuppressed, maybe they're on chemotherapy for breast cancer. That's going to be the majority of people who are going to get sick.
Dr. Page says following social distancing is a way that everyone can do their part and take care of one another.
By doing the social distancing, we need to cough, we develop symptoms, just simple things about thinking about others, instead of thinking about ourselves first.
It's important to understand that these projections are based on the assumption that people are going to continue to practice social distancing through May of 2020. And if people don't listen to the CDC or the guidelines set for them, these numbers can still change. Reporting in Odessa, I'm Felice Romero.